How do we identify pet allergies? This can be a challenge worthy of Sherlock Holmes. The identification of some allergic conditions can be achieved with deductive detective work. For example, if you spray an air freshener and your pet breaks out with an itchy rash, you may notice the cause and effect connection. By allowing the pet to recover and then re-exposing your pet to the aerosol again and seeing the allergic rash, and repeating this a third time, you've likely made a diagnosis on your own. However, in this busy life, there are so many variables in our pets' everyday lives that making these kind of definitive connections can be a complex challenge. Therefore, veterinary dermatologists have devised test procedures that, if followed sequentially and carefully, can diagnose allergies in our pets. When an allergy is non-seasonal, which means those that occur at all times of the year fairly equally, then the first consideration is to identify and test for substances called allergens that the pet is exposed to continuously. The first step is to confirm or eliminate food allergies, which is really more difficult than it sounds. Just a change in the regular commercial diet rarely is successful. In order to rule out food allergens, the pet must be fed a diet containing a novel protein and a carbohydrate that it has never been exposed to in its lifetime. When you look at the variety of proteins and carbs used in the hundreds of store brand and premium pet foods today, you can see what a challenge this really is. One current prescription diet, for example, used by veterinarians as a hypoallergenic test diet for dogs, contains kangaroo meat and oats. Pretty exotic. And a cat hypoallergenic diet may contain, for example, duck and green pea. There can be no traces of any other food sources in these foods, or the food trial could fail. There is another way to approach the food trial challenge today. There are some prescription test diets that contain animal and plant proteins that have been chemically treated to break the proteins into tiny fragments that are so small that it's theorized that they are too small to cause allergies. Now, not all veterinary dermatologists agree with this theory, but because these hydrolyzed foods, is what they're called, are made from normal pet food proteins and carbs, we will often use these when pets just will not eat the more exotic test diets. Whichever food is chosen for the test, the next challenge is to get your pet to eat it exclusively for 8 to 10 weeks, the length of time necessary to conclusively rule in or rule out food allergies. During this time, no commercial foods, no rawhides or pig ears, no meat-flavored medicines, and no table food can be given. If your pet's allergic symptoms completely resolve during the test food trial, a diagnosis of food allergies can be made, and then a long-term feeding plan can be devised with your veterinarian. When food trials fail, or if your pet has seasonal allergies that only flare up at certain times of the year, then tests for specific allergies in the pet's environment and in the outside world must be undertaken. The two commonly performed tests are the intradermal skin test and the serum allergy test. The intradermal test is usually performed at the veterinary dermatology specialist's office and involves drawing a grid of small squares with a marker on the shaved side of the animal and then injecting tiny amounts of the allergens that are common to our region of the country. These could be extracts of pollens from grasses, weeds, trees, and things like molds, mites, flea saliva, etc. Then any reaction to these substances are recorded over several days. The other type of test, called the blood serum allergy test, is performed either at the dermatologist or in your veterinarian's office. It consists of drawing a blood sample from your pet, sending the serum to a testing lab that has sophisticated equipment to detect minute amounts of antibodies in the blood to the allergens causing the pet's allergies. Once it is determined what your pet is allergic to, then a treatment plan can be formulated, which will be the topic of part 2 of this series. And that's another pet health tip from the staff of the Pittsburgh Spay Vaccination Clinic, a full-service veterinary facility.